You think COVID's bad? Let me tell you, diabetes is a real pandemic right now. Diabetic, limb amputation, and limb salvage. That's what I'm really good at.
Meet Dr. Kirten Parekh, a regenerative medicine and longevity doctor, podiatrist, and TikTok influencer.
Recently decided to get my VO2 max because it's the gold standard for measuring cardiovascular fitness.
Dan had the highest VO2 max out of anyone that's had it done at Hudson, which is insane.
What did you have that made you sick?
E. coli infection when I started my dream job as an attending. Bought a Porsche, I was feeling good. 2 months into practicing, started losing a pound a week. Got diagnosed with ulcerative colitis, Crohn's, IBD, IBS. Tons of doctors, hundreds of $1,000s later. I was like, all right, screw this. I'm gonna take this into my own hands and figure it out. And I kind of did. When I was going through my flare, I bought some baby formula to help prevent leaky gut.
So what will detect cancer?
Lesions, cancer, tumors at the FDA. Shame on them for banning that have profound impacts for a lot of people that have chronic autoimmune inflammatory diseases.
And the answer is? I always thought that the main patient would be someone who's an athlete, but they're actually people who are suffering from diabetes, right?
Yeah. If you think of patient volume and who we have to treat, you think COVID's bad? Let me tell you, diabetes is a real pandemic right now.
Mm-hmm.
So it's really difficult to see just exclusively sports med patients. Even the athletic team MDs, they see other patients with other pathologies and just regular stuff, sprains, strains, also along with, rheumatoid arthritis, osteomyelitis. These kind of doctors see a full range of things. So I've kind of leaned into the diabetic, limb amputation, and kind of limb salvage, not amputation, I should say limb salvage, because that's what I'm really good at. I find it to be pretty satisfying, getting a quick result for patients with the combination of nutrition, surgical intervention, and clinical care, which includes wound debridements, HBO, different types of supplements we give the patient. And it can translate over into healthy patients too.
So when you have a patient who is diabetic and they need a limb amputated, I can't even wrap my head around how horrible that is. They're already suffering from obesity, right? They're already
Not necessarily.
No?
Yeah, most are, but diabetes is a disease that does not discriminate. So you can be thin and still be diabetic.
Oh, right. Okay.
Right.
That would be type
2 as well.
Type 2 as well?
Type 1, type 2 doesn't. Type 1 is more like an autoimmune genetic thing, and type 2 is usually induced by multiple factors, mostly diet. So yeah, that again, when someone has to go through a limb amputation or any sort of appendage amputation, when it comes to lower extremity, it's the last case scenario. Absolute last case scenario. So we do everything we can to save that. Usually when I see patients in the hospital setting, in the ER, it's very much a situation where they're at the last stage already. They have an infection, cellulitis, blood count is really, really high, and something has to be done. So we take it in a few stages, meaning that let's say a patient comes to the ER with cellulitis, which means that there is a soft tissue and or bone infection. Bone infection is osteomyelitis. And that's when bacteria, fungi, viruses get down to the bone and cause bone destruction. When it's at that stage, surgical intervention usually is necessary. So again, that's last stage stuff, but patient comes to the ER, we have him evaluated by 3 different teams. My team, which is podiatry, foot and ankle surgery, infectious disease to culture the wound and get the antibiotics that are appropriate for that bacteria or fungi that's affecting the wound and or bone. And then the third, which is one of the most important, is vascular surgery or a vascular consult. And what they do is they check the blood flow down to the area, because with diabetes, blood flow and neurovascular compromise is very common. So we restore blood flow, we get the proper antibiotics, and we do a surgical intervention. And that provides really good healing. And it has to be done aggressively. A lot of hospital systems sometimes don't really coordinate really well. I think we have a good system now where we just go in really hard in the paint and get some results.
How does someone who's just listening, who's not there yet, but wants to minimize their risk of this?
The best indicator is a blood test called HbA1c. I think you've done it as well.
Okay.
So it stands for hemoglobin A1c. It basically is a long-term blood sugar test, an average of 3 months, that tells you where your blood sugar is at over a long course. So right now, let's say you ate a croissant, and you had your blood sugar checked, it'll probably be somewhat high. Doesn't mean you're diabetic, just means that you have some insulin spike from eating food. So in this case, this tells us like, hey, are you really insulin resistant? Is your blood sugar really, really high? So for example, a 5.8, 5.6, perfectly normal. Anything above a 6 is usually pre-diabetic. Anything above a 6.5 usually indicates that you have some sort of problem managing your blood sugar, and that you should be on some medication and or dietary intervention. I've seen A1Cs as high as 15, which is insane. It's 3 times the normal limit. So blood sugar is extremely high. It's causing nerve damage all over the body. It's pretty dangerous, yeah. So A1C test is what you want to see. We do dietary interventions to lower that A1C, maintain it usually below a 7 if you're diabetic, below a 6 if you're trying to optimize. That can be done numerous ways.
Let's chat about Klora, the pre and post biotic
Definitely
that you've created.
Yeah, one of the things in my healing journey was understanding the microbiome. I had 2 friends that had an interest in starting an e-commerce company in this space. So what we did was we created 2 SKUs. One had prebiotics from breast milk. It's not from breast milk, it's from a lab. It's called 2FL. When I was going through my flare, I bought some baby formula over the counter. I think I told you that before. And got some okay results. And I thought, oh, this 2FL stuff is interesting. Let me see if I can isolate it and take it as a supplement. And then I gave it to some of my friends. They liked it. And Dan Snow and John Snow, my co-founders, wanted to build a company out of that kind of notion. So we have a prebiotic in one formula, and then with it is something called a postbiotic, which is butyrate. Butyrate is one of 3 kind of short chain fatty acids that your body produces and consumes, and it's the main fuel for the colonocytes, the cells that line the digestive tract. So it's really important that you have good short chain fatty acid production in your body to help prevent leaky gut and kind of address some of the gut issues that we have. So yeah, we have 1 SKU on that, and the other SKU is digestive enzymes, just a really great blend of 6 digestive enzymes, mostly from vegan sources, plant-based sources, that help with when you go out. There's a lot of God knows what in the food. So when I go out, I kind of eat the enzymes right before I eat, and really helps out. So yeah, created the company, scaled it. Now we're going to see if we can have an exit in some way or another.
And tell us about the mother's milk aspect.
Yeah, so breast milk specifically, there's all these different types of immune factors and growth factors, including 2FL in breast milk. That's why, if possible, I encourage all new mothers to breastfeed their babies.
Yeah.
The protein, which is unique to mammals, HMO, 2FL, it's only in humans, and it's theorized that it's one of the important reasons why we have such a robust microbiome and how we think the way we do.
So what are natural ways we can improve our gut health?
The first thing, honestly, I mean, I know we've made this point ad nauseum where when we go to Europe, we feel better just in general. Why is that? There's a few reasons why. One of the reasons, in my opinion, I learned about this in school too, is that there's a guy named Norman Borlaug, I think that's how you pronounce it. He was the father of the Green Revolution. And he created the pest-resistant wheat germline. He won the Nobel Peace Prize for saving 1 billion lives because of this germline was essentially resistant and prevented famine in many parts of the world, saving 1 billion lives. The side effect, it's a double-edged sword. The side effect that is theorized is that this seed was highly invasive, so it ruined a lot of diversity in our country, specifically in North America, for wheat and gluten. And it was high in gluten as well. So we lost diversity, it was high in gluten, and it required fertilizer and a lot of water. So double-edged sword, prevented famine, lost diversity. So, nature is a fine balance, and we manipulate nature in that way. So to go to your question, what can we do to kind of help that out? Avoiding gluten in America, I think, is a good point. Avoiding it is key word. If you can tolerate it, great. But definitely at home, I don't eat it at all. If I'm going out to have a pizza or have a sandwich or something, I'm usually fine, but at home I don't eat it at all.
So avoiding gluten in America.
Avoiding gluten in America. Seed oils is a big thing, big hot topic right now with people. Why are seed oils bad? There's a fine balance of omega-3 to omega-6 fatty acid ratios in your body. And in America, North America, the ratio is like skewed to omega-6. Omega-6 fatty acids include vegetable oils, canola oil, safflower oil, sunflower oil.
Which are polyunsaturated fats.
Yeah. Any protein bar, any like packaged food you see, in a supermarket will have acetyl in it. And it's theorized that that is one of the reasons why we have such large issues with our gut, with inflammation. There's patients I have from overseas, particularly lately. I had this couple from Italy that came recently. They're like, wow, I feel like shit in America. I'm like, well, look at our supermarket, We have this illusion of diversity and this illusion of healthy food. So I think food is really, really important. It was a big part of my healing journey. There's a lot of things you can do, and it's not even a super costly thing. It's a matter of curating and really finding high quality foods, nutrient dense foods for you and your family.
And tell us the difference between Kacene A1 and Kacene A2, butter, kefir, yogurt, milk. Yeah,
it's theorized that A2 dairy, which is becoming more popular in America, literally as of like this year, I saw A2 dairy, A2 kefir, A2 yogurts coming in on the shelves. And it's theorized that A1 casein versus A2 casein. A2 casein will be less inflammatory, less digestive issues for people that are sensitive to dairy. There's people that are lactose intolerant, mostly, like I feel like everyone is nowadays. So some people are having better issues with A2 dairy, or better tolerance, I should say, with A2 dairy. And it's more like they advertise like more European style dairy kind of thing.
Well, I think controlling your environment and staying consistent, being disciplined, making a smoothie and cooking your dinner every night, and then when you go out, avoid things. But
I like the notion that our mutual friend Sean says too, of being anti-fragile. Mm-hmm. If I went keto for 3 years and I had a pizza, I would die. So I like to encourage patients to live their life and to enjoy, food amongst friends, because otherwise what's the point of living if you can't enjoy a pizza every now and then? So I encourage my patients to do the same, even if they're diabetic. It helps tolerance.
In terms of gut health, what's been a big factor in my life has been increasing my fermented foods. I know that when I was training triathlon, I had to ingest sucrose, fructose, and glucose, these fast sugars. Ever since I stopped training triathlon and I kept eating 3 servings of fermented foods per day, I don't crave any sugars at all, like sweets. Because when I was training triathlon, I would have to eat a pint of Van Leeuwen every night.
Wow.
I was hungry, but I was also craving sugars, and I just, cane sugar, and my glucose didn't spike from cane sugar. It's interesting. But ever since I stopped ingesting these fast goos or when on the runs or on the bikes, also my engine isn't firing. My glucose isn't spiking. Have you tested with a CGM?
Yeah, I have, and I love it. I do it once a month, or sorry, not once a month, one month out of the year. I'll have a CGM on just to see what my tolerances are like. The first time I did it, it was really interesting. I was eating lunch, and my lunch of choice, when I like something, I just usually eat it for months on end. It's hilarious. But I was eating a burrito, I think. This was in 2022, just like every day.
I had a burrito face.
Did you? Yeah.
From the
Dude, burrito all day. It was great. So I was eating a burrito all day, got the CGM, and I was wondering why at 3 p.m. I had this energy crash. So I took the CGM, ate the burrito. My blood sugar spiked like crazy. And then I had the burrito bowl the next week without the corn tortilla. And my blood sugar was not as high. And so I avoid corn now because for some reason, I don't know what it is, with American corn, my blood sugar spikes like crazy with corn. Mm-hmm. And it's very individual. So I like to give that kind of piece of encouragement where, hey, wear a CGM, see what you tolerate, see what you like. Not just the blood sugar spike. I think a lot of people are, oh my God, I ate some blueberries and my blood sugar went really high. Maybe this is bad for me. Not necessarily true. I think insulin response is really, really healthy as well. But seeing how you feel on the CGM is more important than the actual numbers up and down, because you will get a sugar spike no matter who you are when you eat a handful of blueberries. Doesn't mean necessarily it's bad for you. But if you have a crash, or you feel like shit after eating certain foods, correlating that with your CGM.
It's when you can recover from the crash versus crashing, right?
Yeah, it's a number of things. That's one of them.
Recovering from the spike.
Right, recovering from the spike, recovering from the spike, make sure you're not insulin resistant, but also understanding that, hey, I have steady blood sugar throughout the day. I feel pretty good. I'm energetic. I don't have any like acne or any other secondary side effects of eating the foods I'm eating. Really important.
So tell us about insulin for a minute, because from what I understand, we use insulin to take the food we eat and push it into our Krebs cycle, right?
It helps with metabolism. Yeah, it's essentially breaking down glucose.
Okay.
And bringing it into your tissues.
And if we have excess spikes, then it gets stored as fat, right?
Yeah, that's maybe a little bit too simplified, but so the idea is your insulin is made from your pancreas, from your beta cells, and you want to have good insulin response to the environment. What happens in people that are insulin resistant or metabolically, I guess, not efficient is you don't really have the proper kind of engine room to produce the energy that is needed to when you eat sugars and things like that. And that causes a lot of issues like high blood sugar, which can cause nerve disease. So to go on a tangent and talk about the issues that happen with nerves is when your insulin is resistant and you don't process that sugar, it goes into your blood and it ruins something called C myelin fiber nerves, which are really, really small nerves. They're in your eyes, they're at the tips of your fingers, they're in your kidneys, and they're actually all in your feet. In my job, I see a lot of that because your foot and ankle, people always wonder why diabetics have neuropathy in their feet and not their hands, is because it's the furthest away from the core, and those nerves are most sensitive to insulin resistance and high blood sugar. So that myelin sheath, the covering of the nerve, gets destroyed, and you end up getting neurovascular compromise, and then proceeds to neuropathy, tingling in the feet, which proceeds to injuries, ulcers, and then infections. So it's a whole process. But yeah, having insulin response is good. It should be encouraged. But the foods that we're eating are so engineered and not really nutrient dense anymore that our bodies are like, what is this? This tastes so good. This is such a big dopamine spike for me. Let's pursue it more. It's almost like I don't know if this has happened to you, but I'm sure it's happened to everyone else in the audience, where you eat one scoop of ice cream from the pint, like Ben and Jerry's or whatever, and you're like, I want another, and then that doesn't end until you finish the pint. And even then, you're like, wow, I feel like shit. So
3 pints for me.
3 pints for you. Oh my god. Yeah,
I'll order one, and then then the movie won't be over, and then my girlfriend will put on another movie. Then I have to order another pint, and then after the third one, I feel like crap.
Yeah, I'm like that with macro bars. For some reason, late at night, I have these thinking psychotic episodes where I'm just like have this
macro
energy.
Bars.
Yeah.
What are they?
You never had them? Oh,
I don't eat bars.
Dude, I have a bar addiction. It's so bad.
Well,
I won't drink alcohol, but I'll
well, you need bars.
Yeah, for all this, yeah. Like I'll be home at 9 p.m. and I'll have this spike of energy, but then I'll be hungry, and I'll be like, all right, well I can't eat a meal right now, so I'll eat these macro bars. But again, not good. I had 3 last night and didn't have good sleep because of it. So it's a bad habit, not encouraging it at all. Yeah, but it's a vice, Hey.
Routines. What's your morning routine? Monday through Friday, non weekends.
Yeah. So lately, I've been taking a hero dose of L-glutamine, about 50 grams per day. So I'm doing that right now to help kind of seal some of the damage I've had in my gut, just as a trial. Very cheap supplement. The thing is, I do believe it takes a larger dose than advertised to actually see results. So I'm taking 0.65 milligrams per kilogram, which for me is around 40 to 45 grams per day, for about 2 weeks to see what happens. And so far it's been great. In the morning, I take spermidine, which is a polyamine made from chlorella.
It's made from chlorella.
Yeah, the supplement I take is from
okay.
chlorella. Yeah, some are made from labs and things like that. I think it's just more bioavailable from chlorella. I believe Brian Johnson takes the same one. It's from a company in the UK. There's another company called Primidine, and there's another one called Spermidine Life, which is from the UK. All 3 are decent sources. I don't look at my phone for the first half hour. I think that's really, really important. With the exception of today, I had to call you too because I was late. But I think it's extremely important because I think what happens is, just like this cup, you start your day off with a full, this is not scientific at all, but I'm just making a little analogy. You have all this dopamine, all this energy, and then you look at your phone and you start your day like this. Why? Because, and this is the first 30 minutes. It's almost like when they say don't drink coffee. First thing waking up, wait a little bit because of adenosine receptors or bad feedback. I think the same thing happens when you look at your phone. You're getting pinged from emails, getting pinged from text messages, doom scrolling a little bit in the morning, news.
Baseline's rising.
Your baseline stays low when you actually start your day off looking at your phone. So what I do is I keep my phone in airplane mode. I don't know if the EMF things help with sleep. Maybe it does, maybe it doesn't. But take a shower, do my thing, get in my car. I commute to work still in Jersey. So then when I get to work, I usually have another 20 minutes in the parking lot, turn my phone off airplane mode, and then I'll get my pings and I'm ready to go start my day. That way I'm really starting my day with clear, clean mind, and I'm not really, boggled down.
Do you have any volumetric releases of dopamine during the day?
Honestly, like when I'm in the OR,
Coffee.
In that way. No, I don't have any caffeine. I don't have any stimulants. No. I do enjoy coffee as a treat, but I'm so hyper and energetic in general. If I drank coffee, I would rule the world. So I try not to put that upon people.
Do you mix it with oil?
MC2 oils?
MC2 oil.
Okay, so what's funny is when I was having issues with just nutrition and like gaining weight and stuff, I would use MC2 oils because medium chain triglycerides are actually absorbed in the small intestine earlier on. It did help with energy for sure. Yeah, I've done that in the morning. I'm trying to think of other things I've done in the morning. I definitely drink a lot of water in the morning. Sometimes I bought the same. Actually, after the last podcast, I bought the unflavored LMNT. It's really good. So I'll do that if I'm dehydrated.
It's the only one that doesn't have maltodextrin in it.
It's.
I emailed them and they got back to me and said, yeah, but it's only a milligram per pack of maltodextrin. I have one of those every morning, and then I'll take the citrus at yoga in the evening. What happened to you when you were away overseas? Let's get into that a little bit.
I got
your story.
This was a while ago, but I got hemorrhagic E. coli infection when I was in Asia. I was doing this like mission thing with my chief of orthopedics, Dr. Shah. He sent me to the hospital called Civil Hospital in Asia, and I was doing this like not fellowship, but like a mini 1 month, 2 month experience. Let's put it that way. Where I was just doing surgery with the orthopedic surgeons there, just seeing. Because what happens is when you're out of residency, you don't get to do the things you're doing in terms of the full body exposure. I'm doing foot and ankle, so I'm not legally able to do anything else. But as a resident, you can experience all these different specialties and really scrub in with the surgeons and get to understand what they do. So I did that at Englewood Hospital when I was a resident there. Went into vascular surgery for half a year, was in plastics, was in general surgery for half a year, and podiatry and foot and ankle the rest. But got like exposure to everything. Vascular surgery was really, really impressive. It was like, there's a guy named Dr. Diabetic. He was one of the fathers of vascular surgery in North Jersey and New York City at Mount Sinai. And we were doing like carotids, clearing out carotid plaques in different parts of the body. They can do dialysis ports, like a numerous number of things. They do bypasses, a lot of bypasses we did. What that means is that you essentially get a synthetic graft or a vein, like a saphenous vein from the leg. You graft that out and you replace it with a portion of a vascular system in the lower extremity that needs more blood flow. An angiogram, which is the majority of things that I deal with now as a consult, is basically have a diabetic patient that has poor blood supply, goes to vascular surgery, they see, or even cardiovascular surgery, they see that there's lack of blood flow. They'll stick a tube down the groin, make a little incision in the groin, stick a tube all the way under fluoroscopy, under image guidance, and they'll see, hey, there's a plaque here, or there's a pinch here in the vessel. Let's open it up. And they'll open up with some of the machines that they have, providing more blood flow to the lower extremity, to the smaller blood vessels that sometimes are the size of your hair. So it's really hard to open up these vessels. And they do so proximally upper to help with perfusion, which is pressure and blood flow down the lower extremity. But I'm going on a tangent here, but that's essentially what it is.
Okay. Okay, so you were there, and what did you have that made you sick?
In layman's terms, E. coli infection. Took a ton of antibiotics to get better.
What was it, from the water?
Dude, I have no idea. I was staying at a hotel, so everything was great. It was like the last day I was there, I got this horrible infection.
Oh,
so
Jesus.
Could have been a sandwich. I mean, you've seen those TikTok videos in India, how they're like just disgusting in terms of the hygiene. So you never know. And we're very, not weak, but we're very hypersensitive as Americans because where everything's so clean, everything's sterilized. Our food has no enzymes on it anymore. So yeah, there's a lot of weak guts in America when we're traveling overseas. I'm sure there's tons of stories of people going to Mexico. The only place I haven't gotten sick is Europe.
So, E. coli infection, you got diagnosed here or there?
Yeah. I was fine, gained my weight back, was perfectly fine. And then I started losing like a pound a week.
This is 2018.
Yeah, 2017, 2018. Yep. Started losing a pound a week. Of course, when I started my job, my dream job as an attending, I bought a 911, bought a Porsche. Like I was feeling good, was operating, was single. I was like, this is great. Like I worked really hard, worked my entire life to do this. And like 2 months into like practicing, I got sort of like losing a pound a week out of nowhere. And then, got scopes done, got diagnosed with ulcerative colitis, then it was Crohn's, then it was IBD, and then it was IBS. It was essentially like tons of doctors, hundreds of thousands of dollars later, got the same diagnosis, right? So I was like, all right, screw this. I'm gonna take this into my own hands and figure it out. And I kind of did. So that was essentially the whole, starting of the process. And then I went to nutrition school, learned about this. But the silver lining here is, and for anyone that's also suffering from this or any other autoimmune disease, is the things you learn about your body, if you don't speak out about them, other people that are suffering with you won't learn from them, and also your physician team won't understand what you're going through. So I encourage everyone to kind of speak up and be their own patient advocate, not just for themselves, but also for the betterment of the people around you. And
you've had a few alternative treatments.
Yeah.
Can you share those?
Yeah. I've had it all. The things that really helped me lately are obviously, apart from dietary treatments, is peptides. I think are really, really good. And it's a shame that the FDA, shame on them for banning them, or even speaking about banning them, because these are amino acids that can be patented, that have profound impacts for a lot of people that have chronic autoimmune inflammatory diseases. And forget that, it's a great asset to have as an athlete, as someone who wants to recover from something, a small injury. One of the things that comes up that's really popular is BPC 157, body protective compound 157. It's actually made in your stomach as well. 157 is just amino acid, and it produces a response for wound healing, for collagen synthesis, for things like this, among other things like angiogenesis, which is increased blood flow. So I understand regulation behind it, maybe having compounding pharmacies, third-party test them, and doctors prescribing them. Sure, create a network for that, but don't outright ban them because you're leaning on FDA or pharma to make money off of patented peptides, like GLP-1s, which are semaglutide and Ozempic, these types of things. So I've done that. Other things that I've tried is FMTs, which is fecal microbial transplant. Did that in a pill form, didn't do much. Because
was it someone's random fecal?
It was a third party tested lab. We had like a super high end elite athlete kind of donate, and we had it done through a lab. It was like kind of like an off label thing we did. One of the benefits of being a physician is I was able to do some of these experiments.
Was it a capsule?
Yeah, this capsule. Yeah.
It's
enteric coated, so it's opened up in your colon.
That's amazing.
Yeah, it was wild.
Was it? Did you do a Genova diagnostics test after?
Yeah, I did that before and after. No real. I mean, there was some diversity changes, but what the crazy thing about the microbiome is, diversity leads to better outcomes in almost every situation. But if you were to take 10 people off the street and test their microbiome, like 9 of them would have dysbiosis, right? But they don't necessarily have Crohn's disease or ulcerative colitis. So what the hell's going on? So I think it's a multifactorial thing. I think you get an infection, your body just doesn't stop responding to that infection. There's leaky gut. But again, there's all these like tests, and okay, great, you have leaky gut, you have UC, you have Crohn's. The hell does that mean? What do I do now? Treatment protocols are just garbage. It's all Humira, biologics, ASAs, which is kind of anti-inflammatory drugs, and that's not necessarily the answer.
And the answer is meat, prebiotics, and postbiotics.
The answer is throw everything you can at it.
Fibers,
yeah, throw everything you can at it, see how your body reacts, but do it in an organized fashion.
Hey everyone, I just want to interrupt for one moment and ask for your input. We're striving to make this channel even better and more valuable for all of you. So if you have any constructive feedback, suggestions, or questions I have missed, please don't hesitate to share them below. Also, if you enjoyed this episode, please leave a comment or review on whatever platform you stream the podcast. We really appreciate this. We have a goal of hitting 50 reviews by the end of the month. Your contribution won't go unnoticed. Thank you for listening. And now back to the interview. What other alternative treatments recently? So
I did an SGB. I did the neuro reset. I think we did it together, right?
Yeah.
Yeah.
Well, I didn't get the Stellate Ganglion injection. I got the ketamine infusion.
Right. That was awesome. I'm still benefiting from that. So that was awesome.
Ketamine?
The ketamine was interesting. The Stellate Ganglion.
Yeah, tell us what that is, because it's supposed to be for those who are in a sympathetic state, who are kind of stressed out and fight or flight all the time, and they need a reset. But you didn't really need that. You needed it more for your gut, to target your gut. So
it didn't help much for my gut. Maybe it did. I'm not sure. But it definitely helped with my stress response in my body. Okay. So I'll give you an example, or I'll give you an explanation of what it is and how it affects the body. So there's a cranial nerve called the vagus nerve, or vagus nerve. I don't know how people pronounce it. I like vagus. 10th cranial nerve, it affects your fight or flight response. It also affects your heart rate, affects digestion, rest and digest, kind of part of the nervous system. So there's these contraptions, electronic things that you can put on your neck or your tragus to help stimulate the vagus nerve, which definitely helps with sleep. Your HRV can help with digestion, can help with the vagal tone. So it's just like the muscle tone of the, well, not muscle tone, but the nerve tone, the strength of the signal going up and down your brain. So our mutual friend Jonathan Kuo has this procedure that he's kind of innovated from his teacher, one of his attendings, and it's called the SGB. We call it the neuro reset, SGB block, stellate ganglion block, V shot, neuro reset. There's tons of names for it. We're going to call it the neuro reset. 2-stage block. The first stage is they go under ultrasound guidance, give you a long injection, which isn't painful, by the way. I thought it would be. I didn't feel any pain at all. It's like a 10-minute procedure, not even. And they'll go parallel to the vagus nerve, give some bupivacaine, which is a long-acting anesthetic, to help kind of shut down that signal. And you'll see droopy eye, and your face will kind of go a little, maybe partially numb, which is a good sign, means it's got the right area. It's only for 6 hours. And then they'll inject some peptides like C-Lang or C-Max to help with that vagal tone. Second part of that injection, in the same injection, is something called hydrodissection. So opening up the tissue around the nerve area to help it breathe, so to speak. And the idea for that is there's a lot of people that have PTSD, chronic stress, that's outwardly. I think I'm very calm and collected in general. I would like to think so. And I was before and after this shot. However, going throughout the day with startup grind, work grind, and just social stuff that we go through, I think your body reacts subconsciously and holds on to stress. So I still have stressful days, but I think my response physiologically is different for sure. I definitely felt that way. Whether it'll last for a long time, I'm not sure. Some people last for many weeks. Some people last for many months. I'm hoping I'm in the many months category, but I definitely feel a huge difference before and after the injection in terms of my stress response physiologically. Like I don't have that, it's called an angina, or like that cortisol spike. Someone gives you a bad phone call, or like deer runs in front of your car and you get like, oh my God, and that lingers. So the idea was, stimulate the vagus nerve, reset it, help with the digestion. Maybe it did, I'm not sure, but definitely wasn't a 9-day difference, but definitely helped my stress response. So that's another alternative treatment. I'm doing HBO next, so HBOT, hyperbaric oxygen chamber therapy, which really helps with wound healing. We have 2 chambers in my hospital. It should be done by a physician. There's some risks to that as well. So we screen patients that are in the hospital setting because a lot of these patients have cardiac issues and stroke issues and stuff like that. So we have to make sure that they're qualified before they go into the chamber. But
are you doing that for like an hour a day for 30 days or something?
Yeah, I'm gonna do like I'll record it too. I'll do like a everyday thing for like at least 2 weeks.
You should test your telomeres before and after as well.
That's not a bad idea. Yeah, we have all the testing there too. So to talk about longevity clinics, I think a lot of people are adding the name longevity to their primary care practice. That's absolute BS. You don't have a longevity practice. You have a med spa that doesn't really do alternative treatments that are clinical. So that's why I like the idea of having real alternative treatments available in Manhattan at West Village at our mutual friend's place, Jonathan Quo's place. So you go to your primary care physician, what do you get? A goddamn like BMI, blood pressure, maybe if you're lucky, a blood panel with your CBC and HbA1c. You don't get any of these alternative things like apolipoprotein B, access to treatments like this. It's important, and that's the way the trend is going.
Inflammatory markers, testosterone.
Inflammatory markers, yes. ESR, CRP. No one's doing CRP as a primary care physician, and not to blame them, and they're struggling too in terms of post pandemic. I actually calculated this out. For me to make the same amount of money I do now, I have to see 1.25 more patients about that from 2020 to now, because of insurance reimbursements, because of patient just volume. And I can only imagine what it's like for primary care. They're spending 5 to 10 minutes for patients, and primary care is like the foundation of our medicine. Primary care is the physician that sees your issues. They're the detective. They refer you out to different specialties to make sure your problems get solved. But we are in a system of sick care instead of prevention, instead of treatment for longevity health span. It's about treating sick patients, and that's really it, because that's where the money is.
So what are you doing at Hudson Medical?
So we are actually rebranding to hopefully be called Extension Health soon. We'll be doing a number of things, including a lot of biometric testing and a lot of alternative therapies. Upstairs, so the West Village office, upstairs will be DEXA scan, which measures your muscle mass and overall muscle density, including bone, and RMR, resting metabolic rate, grip test, VO2 max, which you did. By the way, Ben had the highest VO2 max out of anyone that's had it done at Hudson, which is insane. So congrats on that.
I also had my DEXA and my bone mineral density score.
Did you?
There. Exactly a year from each other.
Oh, okay. And was there a difference?
Yeah, 1.5.
Wow.
Bone mineral density.
Increase.
Wow.
That's impressive. So yeah, these things are important to do.
My visceral fat went down.
Amazing.
Yeah.
Yeah. You wouldn't know until you got it done, right?
Right.
Yeah, exactly. Especially as we age, I think it's important to get done. So yeah, upstairs will be all the testing. They're actually renovating it right now. It's going to be beautiful. I'm really excited to see that. And then downstairs will be all the alternative therapies, peptides, as long as they're legal with the compounding pharmacies, ketamine IVs, basically prescriptions for different types of ailments, for sports med, for aging. We have topical tretinoin, topical copper peptides. Like those are some of the things that we have, but literally we have testing. We have Pronovo, which is amazing. Pronovo, access to full body MRI at a very decent price too. So if you were to get an MRI with your insurance, the insurance will probably charge a few $1,000s at least, even for a foot and ankle MRI to your insurance, obviously not to you. This is a full body MRI that does everything from head to neck. They have different sections. They have head, neck, torso, full body for different pricing, but the full body scan is about $2,000, which is, I think, entirely appropriate. The reason why this is important now more than ever is the past 50 years, things have changed so much in our environment, in our diet, that the rates of cancer, the rates of autoimmune disease, the rates of even diabetes is skyrocketing.
So Pronovo will detect cancer?
Full body MRI will detect lesions, cancer, tumors, different abnormalities in blood vessels.
What about around your heart, like your capillaries and plaque buildup, calcium?
I believe it's a calcium score can be done. It's a separate test. So Clearly. You can do that along with a Pronovo to kind of really see. There's also different biomarkers.
Do they already have a Pronovo machine there, or are they getting one?
Yeah, there's a Pronovo machine in Manhattan. So the way it works is there's actually a wait list. So if you go to Pronovo on your own, you'll be probably a 2-3 month wait list. With a physician partner, you can get that kind of bumped up a little bit.
How often?
Probably just once every few years. Yeah, I'm pretty healthy, or once a year even. But I met with the CEO in West Palm. He was speaking at a conference, and he was saying that we're seeing 1 out of 25 has this issue, 1 out of 30 are finding this. Most people have clean bills of health, but the ones that don't are like, oh shit, I found this out because of the Pronovo exam, and I'm able to act on it quickly. Prevention, again, our healthcare system is what? Sick care, treatments based on sick care. You get sick and then you get treated. No prevention. There's no, to my knowledge, system that is available to all that is really encouraging prevention. And unfortunately right now, it's pay to play. To be healthy in America is to be wealthy, right? You know, in a way. So the idea is that, hey, the trickle down effect will happen. People will be more and more inclined. The cost of Pronovo and all these testing will go down, and consumer behavior, which already is. I mean, look at longevity clinics, and the word longevity is so buzzy right now because people are really into it. People are really into tracking their health, having access to things they can control in their body. And this becomes more popular, just like organic foods became popular 20 years ago because of consumer demand. So the idea is through podcasts like this, through our community, we encourage people to be like, hey, demand this because it's something that we need.
Follistatin gene therapy.
Follistatin gene therapy. There's a company called, it's really interesting. I'm super into it. I hope to get it done this year. There's only 200 people that have gotten it done.
200?
Yeah, in the world. Brian Johnson's one of them because he's public about it. Tony Robbins is another. He's public about it. There's a few others that we know. We can't talk about it, including athletes.
But it's a procedure, right? You need a month because you need to prepare with peptides to go into it.
Not to my knowledge. I don't think you need to prepare for it.
The one in Cabo, the clinic?
Eterna,
yeah. They want you to prepare with
do they? Okay.
pre with peptides, so your cells are in a senescent state.
Got it. Okay.
Not to maximize the gene therapy, it's to maximize the stem cells. But you would want to do
okay, got it.
You can do both at the same clinic.
I see. Yeah, that's run by Adil Khan, who's kind of a pioneer in this space, and Jonathan Kuo and Adil Khan work closely together. So they're both in the same area. Adil Khan's all over the world. Jonathan Kuo's right here in our backyard, so that's the benefit. But so gene therapy is actually illegal in the States right now. That's why you have to travel to Prospero, Honduras to get that injection done.
Sign me up.
I'll explain the gene therapy, which is super interesting. It's made by a company called MiniCircle, and what they did was, so gene therapy, especially for diseases like ocular degeneration, generally speaking, they've had it in a viral vector. So a virus is injected into your body, it goes to every part of your body, and you're able to synthesize new proteins based on that virus. But that's permanent, can't be changed, right? So the idea behind this company is that they have a plasmid gene therapy where it's injected, the DNA is transcribed into proteins, and there's a kill switch there with antibiotics like tetracycline if you don't like the results or something's going off. Really interesting company called MiniCircle. The founders are really eccentric, out of the box thinking individuals. I love the idea of gene therapy that is switchable on and off. But follistatin is a pretty safe mechanism. What a follistatin does is, for the people in the audience, you can look up myostatin deficient humans or animals, and it looks like a meme. It's like a super buffed out dog or cow. And those animals live short lives because the heart can't pump through all that muscle. That's like a complete deficiency in myostatin. So myostatin stops muscles from growing, like skeletal muscles from growing, and follistatin puts the brakes on myostatin. So as we age, our follistatin goes down. We're having trouble gaining more muscle, especially after our 40s and 50s. So the idea is you inject this gene therapy that increases follistatin in your body through the transcribing of the proteins. You're able to build more muscle, but that's the side effect of it. Really what it does is it helps with inflammation, because follistatin is a potent anti-inflammatory, helps in neurogenesis, because anytime you build muscle, you build more nerve tissue as well. You have a profound effect over 3 years if you utilize it correctly, including working out, eating right, all that stuff. So the individuals that you and I know, they've told me 3 things. Number one, that their feeling of their body in 3D space has changed. Meaning that one of our friends is a dancer. He says that my body in 3D space feels like I have more of a connection. That was the feedback I got. The second feedback I got, so do you remember when you first started working out at 15, 16 years old, and you're like, damn, I'm getting jacked, you actually feel like a physical,
some veins.
Yeah, you get some veins popping. You're like, you're showing your friends, like, look at this bicep vein, dude. Like, it's exciting.
I've never seen a muscle right here on my come out on my arm or something.
Exactly. And now we're just like, all right, well, I can move my pecs, and that's the cool party trick I have. That's what they've reported, that I feel like I have newbie gains again, where I'm able to work out and see actual results very quickly. And then the third thing is, on the biomarker side, there have been lowered CRP values, which is the C-reactive protein, which is the inflammatory markers. So it's exciting stuff. Again, 200 people have that done around the world. I know 6. All 6 have said good things. But again, that's such a small cohort of people to really derive any information from.
What's the price point? I know a few of them got it probably for free.
Yeah.
But
through clinical trials, right? So the price point is around $25K. Adil Khan, you can go to his Instagram, and he actually has a few videos of him injecting some celebrities, which I think Juju is one of he's a bodybuilder, like a gymnast guy. He got it done on camera along with the world champion for arm wrestling. I forget the guy's name. So they both had it done. And it's expensive.
Enhanced games.
Yeah, exactly. They're all enhanced now.
That's a good transition.
What's crazy is that it's not detectable, to my knowledge, unless you're able to measure Follistatin.
So all the Tour de France riders are going to be in Cabo this summer?
I hope so. So we have some more information. Yeah, it's pretty crazy. Brian Johnson's whole thing on don't die is, and I made a post about it recently, don't die for the next 2 to 3 years, because every 6 months, the world around us is changing, and people are not privy to it at all. They have no idea what's going on. The problems that you and I have that we actually worry about really mean nothing in the grand scheme of things, because we are at breakneck speeds going towards the singularity, which is essentially AGI, artificial general intelligence. Once a company achieves that, the world around us has permanently changed. Then he talks about zero principle thinking. And an example of that is back in the day, Copernicus, Galileo, Kepler, they all kind of pushed the heliocentric model of the planets revolving around the sun instead of the Earth being the center of the universe. And that kind of blew everyone's mind. They're like, no, fuck off. This is a religious thing. This isn't true. But it turned out to be true. And that was a zero principle thinking pattern where it wasn't proven, but it was proven later. Someone had to think about this and really exemplify the idea that this is the way the world is, and the world will change for the better based on this idea. Another example is microbes. Some guy in the 1700s was a doctor and realized that my patients are getting sick, maybe from an invisible thing, viruses, bacteria, fungi. Try to tell that to someone back then, and they'll probably kill you in front of the town square. But it turned out to be true, right? Until the invention of the microscope, we weren't able to prove that. That was a zero principle thinking that changed the entire course of our planet and our species. The same way that every few hundred years, every few years, we as human species come out with a zeroth principle thinking that has changed the course of our everyday, is going to be way more often when AGI comes on board. It's going to be a zeroth principle thinking factory.
So in 50 years, we're going to be looking back and be thinking...
Yeah, someone from the future would be like, how did people not realize that energy is a real thing, and that someone's bad energy can affect someone's, how we have these invisible things that we talk about where someone's karma is bad or someone's energy bad. Maybe that's a real thing that can be proven later on through AI. But on a more practical level, AI models will help us with protein folding, will help us with drug development. Instead of having FDA trials on humans, which are really, really hard to do, because you have to recruit a certain sect of people, they have to be a certain way. It's really hard to do that. It really is, especially nowadays more than ever. Imagine having a virtual model where you can just test drugs out on different humans with different pathologies and different backgrounds without harming someone. There's a joke in medicine, we say we cured every disease known to rats and mice, because we make mice immortal now. But you can't do that in humans because we can't test the way we do on mice. Do you know what an error curve is? Error curve is essentially like, if this is reality, if this line is reality, or this is the prediction of reality, I should say, the error curve is like what reality actually shows us. So let's say I were to tell you that the iPhone 15 is coming out in October, my prediction, but it really comes out in July. So the error curve is like right here. The point is right here, right? So the error curve for AI is like a goddamn ski slope. Everything that's being shown with OpenAI, Sora, which is text to video. There's something called Vappy.ai. I wish I can show you on camera. It's hilarious. We'll do it after the podcast, but it's this voice model where you can use it as a customer service model, and it talks like a real human being. And that's version 0.5. It's not even version 1 yet. What's going to happen 6 months from now? What's going to happen 5 years from now? This, I wasn't even in
it's a thing. Customer service model you can use for your business?
Yeah.
Now. Anyone's voice?
Anyone's voice, yeah. Or not anyone's voice, but in any type of programmed feedback. And the reason why I know about this is not that I'm like a tech guy.
Because you have multiple startups?
Maybe. But I consume instead of looking at the news, I consume just AI news because I'm really interested in it and how it can translate to medicine and the ailment of our suffering as humans in disease and chronic disease states, myself including. I don't want to be the way I am right now. I'm happy to be healthy right now, but I'm always worried about the next thing. So, and I'm young, you know what I mean? So what's happening to others?
Where do you consume your AI news? What sources?
Honestly, YouTube.
YouTube?
I subscribe to like 4 or 5 channels that it's funny because you can call yourself an AI expert right now because the news changes on a daily basis that no one's an expert. So yeah, you can be a world expert in AI as long as you're just up to date for today because it's changing every day. Anatomy, you can be an expert on because human anatomy hasn't changed for thousands of years. So you can learn that and be an expert on it. That won't change, but AI news is changing every day. And how it translates to different industries. Medicine to me is very antiquated. It's very, very political. People don't want to change. I understand that there's a do no harm aspect to medicine, and we have to be very careful with what we tell the public, including when AI comes on board with imaging studies or note taking. We still, as humans, have to be the harbors of knowledge until that is perfect. And even when it is, we have to double check our work. So I'm excited for the future. I think the don't die thing is that Brian Johnson's translation of that is like, hey, try to stay alive and try to be as healthy as you can and look forward to the future when we have these tools.
Are you taking rapamycin or acarbose?
No, I'm not. I'm waiting for more data to come out. There is this new thing with rapamycin cream. I'm part of this group chat with longevity docs, like 40 doctors here around the world. And they've been seeing some interesting results with their patients with rapamycin topical cream. Or rapamycin, I think a lot of people are taking it. I can't speak from personal experience. But yeah, that's something that, I don't know if Brian Johnson's taking it or not, but there's something that people are taking right now. Yeah.
But the topical cream is for hair or for your face?
For both, for just cellular health on the skin. For hair, I'm not sure yet. Going to experiment with that soon too.
What do you think about Somni?
Not familiar with Somni either. What's that?
We shared it in our chat.
We did?
Yeah, it's a stimulation device.
Oh,
on your forehead.
yes.
And you use it before you go to sleep every night.
Yeah. That looked really cool.
And it helps. It's like 4 times melatonin. I've been using it.
Do you like it? Yeah. We did talk about it earlier.
Because I traveled, but while I was using it, I had some pretty stable sleep patterns. Like I woke up feeling amazing and I went right to sleep. But I've only been using it for 2 nights now. But,
okay.
It needs 14 days to start calibrating and measuring your brain waves.
Super interesting. No, I'm really interested in that because I've been using Parasim and Pulsetta for vagal nerve stimulation. And I've had good sleep on that, and my HRV has increased.
Where do you put it?
Parasim is on the tragus. It's on the opposite side, so I put it right on my ear right here. And the Pulsetta is a little bit harder. You have to it goes around your neck on this side, and it goes on either side.
Which one do you prefer?
The Pulsetta is it's like a dog collar. You feel it. yeah. Parasim, I'm not sure if it's strong enough. You definitely feel that too if you put it up a little bit. It's much more of like a beautiful device. Pulsetta is definitely like.
Does it combine music?
No.
So the Sensei, I have the Sensei. It's just on the chest. And it combines music. The music is incredible.
Really?
Yeah,
Damn.
And it's just this vibration on the chest. It's fine if I'm on a plane, but I want to bump it up and use something more
try the Pulsetta.
technical. Superpower.
Yes.
Can we talk about that?
Yes, we can, for sure. I was part of a incubator in LA with my friend Jacob Peters, and he actually has Crohn's disease really badly. He actually lost his colon from colitis. He's like, I want to create a company that essentially has biotracking and biomarker data, be like a digital clinic in a way. And they have a really solid team now behind them. It's been a year in. I think the soft launch is sometime next month. Met multiple clients through that.
So it's a concierge doctor?
No, not necessarily. We do have concierge doctors there as well. I'm one of them. It's essentially going to be like a digital clinic where you can get your biomarker data, biotracking data. A nurse comes to your house, draws your blood, but you can also upload your blood work too. So we built it for ourselves. Like I had frustration with 8 different hospitals having my CBC, CRP, all that stuff. You know what I mean?
I've been using Live Health for 7 years.
Okay, exactly. So very similar.
Yeah,
very similar. We're trying to make it a little bit more sexier for millennials, Gen Z, and just overall, tech founders. So founder first type of thing. Yeah.
My biggest issue with Live Health was since they were based out of California, I wasn't able to go to a LabCorp here in the city. I had to go to New Jersey because New York City has these strict regulations,
so strict.
Right?
Horrible, yeah.
Like I couldn't ship or receive any of my tests out of New York. I had to go to New Jersey or go to LA and then ship out of LA.
Yep, still same problem. Yeah, same issue. I just moved to West Village few months ago, and I have the same issue now. I have to ship it to my parents' house. So yeah, again, politicians are fucking stupid. They have no idea. Look at the people around us. Who is heading FDA, the governing bodies for health and wellness? They're all fucking fat, miserable. I have no idea what they're talking about. So shame on them for not understanding the way things work and how people are suffering in silence. Got to speak up against that, you know. I'll do so. I don't give a shit.
How does one help change these regulations?
I think it comes from education and consumer demand. Once consumers control the narrative, that's when things actually change. Because the people that are holding office, they have to please their constituents. And how do they do that if they're all sick and they're all vying for some solutions, especially in this market? I mean, it's hard to live. You go to McDonald's, buy anything at McDonald's, I guarantee it'll be like $20-$30. That's crazy, you know?
Chipotle is $16. It's like double meat.
Yeah, if you're lucky.
It's a pretty good deal.
Yeah, before taxes.
It's the best bake for your buck.
It's probably better than any fast food right now.
Chipotle is number one.
Yeah,
it's
no,
grass
in terms of the pricing too.
Oh, pricing.
Yeah.
Oh, okay, yeah.
Yeah, I'm talking about pricing. Yeah, for sure.
It's the best deal. It's high quality, high nutrition. Double the
Great
vegetables.
example of consumer demand is Sweetgreen. I believe the CEO of Sweetgreen or the founding team said that they're not using seed oils anymore. They're going to use Zero Acre or olive oil. I think something like that. Yeah. I know Shake Shack is used in Flatiron is using Zero Acre now. It's the oil made from fermented bacteria. Yeah. It's pretty
What's
good.
it called?
Zero Acre Farms.
Zero Acre Farms.
Yeah. It's a cooking oil that has a high cook point. So one of the issues with olive oil is I believe it's a cook point of 200 degrees, whereas vegetable oil is like 400 to 500. Beef tallow has 400 to 500 as well, which is good to use. But most people use vegetable oil, including restaurants. So this is a fermented bacteria oil. You can use it with cooking, and it's flavorless. It's really good. I put it in my salads. It's great stuff.
Better than olive oil?
It's better than olive oil for cooking. I prefer olive oil for everything else. Cook point. So olive oil, you don't want to have burnt olive oil when you're cooking. So you can't be cooking a steak with olive oil.
Oh, I cook low temperature.
Do you?
Everything.
Okay.
Steak, yeah.
Yeah, I mean,
when you char the steak, it's bad for the gut.
Yeah, agreed. When you do high temperature cooking, you can't really use olive oil because it's going to burn. So this is a good alternative to that, or beef tallow.
Nope, don't go high temperature. I don't go high temperature. Okay, enhanced games. This is very interesting, but I have some thoughts.
Super controversial. It's going to divide a lot of opinion. So the idea behind it, and I do subscribe to the idea. I am in support of it. Mm-hmm. There's a guy named Aaron D'Souza who's leading the charge on this, one of the founders. It's Peter Thiel backed, Christian Angermeyer's backing as well, along with Balaji. So there's three big tech founders are behind the idea. The idea is to have athletes that don't really have, not regulation, but don't have the constraints that Olympic Games do. And the constraints include pay. So we're going to pay all of our athletes to make sure that they don't have to suffer in terms of trying to win. If you don't win gold in the Olympics, it doesn't matter if you win silver or bronze. How many silver medals do you know? I don't know any. Why? Because they don't get anything, right? It's gold or nothing. So that's an issue. Like, you know, in terms of the Olympic Games, it's winner takes all or nothing. So have a prize pool that's appropriate, pay the athletes, and make sure doctors are involved. Because most Olympic athletes are doping, but they're just doing it behind regulation, thwarting different regulations using different compounds. So having doctors involved that can understand, like, hey, we can use peptides, we can use enhancements, the hormones, whatever, within reason to enhance the human potential. And we want to see what the human potential can hold. Who really is the fastest man alive? Who really is the strongest person out there in these different ranges of sports? So we'll see where it goes. It's super interesting. I think it's awesome because it will help open up the criticism and the stigma behind not drug use, but using science to our advantage to be super physiological. I think it's really important. Mm-hmm. Think of it this way. One of the analogies they gave was 3-point seatbelts, airbags, ABS, brake system. All these things came from F1 technology. Or they came from luxury like the S-Class and Mercedes, and it came down to regular cars. But the idea is to have these things maybe in the enhanced games and understand, like, hey, this athlete's using BPC to recover, and there's some benefit here. So yeah, I would love to know your thoughts, and as an athlete yourself.
So obviously I'm pro-science, but I think if kids in high schools are watching a sport that's enhanced, They're going to be going on the black market and buying the next steroids they can put their hands on, and they are going to be injecting themselves in high school. And I mean, they're already doing that, but we're going to be seeing it more and more and more. That's 100%. They're going to be seeing these paces and these times and these power output or whatever watts or what sports are there? Are they running track?
They're doing,
track,
they're going to be doing
swimming?
track and field, MMA, a few other categories. I can't say off the top of my head, but
I mean, MMA, they're already as well.
But the thing is, most sports
it is
are already
exciting.
enhanced. That's the point I'm trying to make.
Yeah, but it's going to be
more public.
It's going to be public, yeah.
Yep.
So you're going to be seeing their tests, their hematocrit, their red blood cells. What drugs are they thinking of using? Testosterone, EPO?
It's not about what drugs they're thinking about using. It's about what the athletes need to use to be performing the best that they can. You know, whether it's for recovery, you know, a lot of these athletes have a short lifespan because of the things they're doing to their body to kind of go around the Olympic Committee testing.
Mm-hmm.
So the idea is to be a little bit more transparent about it so that these people can be as healthy as possible. The idea is to be not just enhanced, but to be as healthy as possible and live a long, healthy life for athletes as well. So the thing is, that whole children looking at things like, that's what happened with everything. Look at rap, look at media, look at the culture we're in right now. It's all, you know, we have to protect our children no matter what, right?
Yeah.
So,
well, maybe eventually it'll open up WADA to, maybe it'll be positive for WADA to open up peptides, TB500 for their athletes, because regenerative peptides need to be legal.
I believe so. Yeah. And hopefully this can drive that, again, going back to the consumer demand thing, drive the public to be like, wow, this is real science. This is actually helping. Either way, whether it's through the enhanced games or another entity, this is the future for our species, where we incorporate science into daily life and actually use these compounds and drugs and or supplements to be super physiological. That's a guarantee. So it's going to happen. How it happens, we don't know. WWE has been known for steroids for many, many years. Obviously not a good thing. These athletes don't have long lives. They suffer immensely from it.
WWE?
Yeah. World Wrestling Entertainment.
Is that the one that's... Well,
WWF, WWE,
did they
John Cena, The Rock.
Did they even test?
I don't think so. It's entertainment. Yeah.
They're not competing.
But who's the main audience there? It's children and teenagers, right? It's not really adults.
Yeah.
So that can be an argument too. I'm sure they've had that argument as well.
But they're not in like high school playing WWE. They're actually doing real sports.
Yeah.
So
that's true.
They're like, how can I get my pace up? How can I get that?
Yeah,
that edge. On the other team.
I think at the Olympic level, everyone's trying to get an edge, whether it's legally or illegally.
Tadalafil's great.
Tadalafil, yeah,
it's a legal PED.
Is it really?
Enhancing drug. It's legal
in Olympics. I don't know that. Oh, okay.
I don't know about the Olympics, but in the tour and in triathlon.
Interesting. That's a great drug.
Because when I was racing triathlon, my coach said it was legal.
Interesting.
But I haven't checked WADA, so.
Got it. Okay, good to know. But yeah, there's a lot of nuances here. But yeah, I'm in support of it. I'm excited to see what happens.
TB500 and BPC were legal, and then they weren't.
Recently?
They were banned by WADA like 3 years ago.
Really?
Yeah.
Wonder why?
Because they work. But it completely healed my left knee. Did I tell you that?
No.
TB500.
Did it?
Yeah.
It was done through IV, or you had it?
Intramuscular.
Intramuscular?
Yeah.
Okay.
Into my left quad near my knee. I have no ACL, no meniscus, lateral meniscus. And then I raced 2 half Ironmans after that.
That's so crazy.
So
imagine some innovations.
Enhanced games.
Yeah. You are enhanced in a way, right? So imagine the innovations we can have when these things are a little bit more accepted in life. And this is being done in a safe environment. It's not like we're just like, hey, like, do the drugs and see what happens. It's like, this is going to be monitored. It's going to be transparent. It's going to be recorded. The seriousness of the organization and the transparency should lead to better innovation instead of just being like, yeah, whatever. You know what I mean? From what I've seen, it's going to be very, very organized and very, very careful because this is the inaugural games. And they might be coming to New York City. So we'll see. New York City or LA is what I've heard.
Did you watch Icarus?
I did.
So sick. 'Cause
Crazy.
You can see his.
I encourage everyone to watch.
Biomarkers and yeah.
Encourage everyone to watch that. It's so crazy.
It's an amazing. It's probably one of the best documentaries I've ever seen.
Because it has a turn. You're watching the documentary,
yeah.
You're like, oh, this is really interesting, and then it takes a
I wonder where
crazy
he is
wild
now.
turn. Yeah, I wonder where
He's
he is.
in hiding in America somewhere.
I wonder where he is too, but we'll let the audience see that. I highly recommend it. And that plays a role too, because, we can't have innovation if we're doing things in hiding.
It also shows how his enhancement didn't work for him. Remember? He raced.
I do remember that.
Yeah.
Yeah.
You put out a post almost every single day on social media, a biohacking, longevity. You're adding value to your audience every single day. You're very consistent. You're consistent in our group chat. I'm very impressed.
Thanks, man.
You have 250,000 followers on TikTok. Dr. Kirten.
Yeah, I changed all my handles to be one thing.
On Instagram, Dr.
Everything.
Kirten?
Across the board, yeah.
Oh, perfect.
Yeah.
Twitter,
So,
Dr. Kirten?
everything, yeah. YouTube, Instagram, TikTok. Yeah, I think that's it for now.
Perfect.
I have an editor that's helping me out, so it'll be a lot more prominent in the summertime when I have some more time.
Everyone should go check out superpower.com, getklora.com. I'm excited about Hudson Health pivoting to
It's going to be called Extension Health.
Extension Health now.
As the longevity proper, not some buzzword, but really actual longevity clinic.
Real longevity
Manhattan.
clinic.
Yeah.
But we can't do stem cells here.
Not legally, no. But having access to places around the world where our clients can go to,
They can send us to Cabo.
that's really important. Yeah. You need it, we have access to it. Whether it's here in Dubai and Cabo, we'll figure out a way.
Great.
We're going to make it happen.
All right, brother. Thank you.
All right, thanks a lot, man.
Man.
Appreciate you.
That was perfect.